Following is a repeat show that was previously broadcast on Unity FM.
يا حبيب الله يا رسول الله يا حبيب الله يا رسول الله يا حبيب الله يا رسول الله يا حبيب الله يا رسول الله. هذا الرسول إذا يبسم ترى الأرض نورا فلا تظلم.
هذا الرسول إذا يبسم ترى الأرض نورا فلا تظلم.
وثار الحبيب إذا ما بدا يداوي القلوب فلا تسقم. وثار الحبيب إذا ما بدا يداوي القلوب فلا تسقم.
يداوي القلوب فلا تسقم.
محياه طلق كقطر الندى على حسنه دائما أقسم. محياه طلق كقطر الندى على حسنه دائما أقسم.
ووجه جميل كبدر الدجى ينير الوجود فلا يعتم.
ووجه جميل كبدر الدجى ينير الوجود فلا يعتم. ينير الوجود فلا يعتم. يا حبيب الله يا حبيب الله يا رسول الله يا رسول الله يا حبيب الله يا حبيب الله.
إذا الليل طال بدا وجهه كفجر الصباح إذا يرسم.
إذا الليل طال بدا وجهه كفجر الصباح إذا يرسم. وتلك الليالي في ثغره عقود الجمان غدت تنظم.
وتلك الليالي في ثغره عقود الجمان غدت تنظم.
عقود الجمان غدت تنظم. يا حبيب الله يا حبيب الله يا رسول الله يا رسول الله يا حبيب الله يا رسول الله. وأنفاسه روضة من عبير
هي الطيب فاحا هي البلسم.
وأنفاسه روضة من عبير هي الطيب فاحا هي البلسم.
يهيم الخلائق في بعضهم
وفيك أهيم ولا أسأم. يهيم الخلائق في بعضهم وفيك أهيم ولا أسأم.
أسأم يا حبيب الله يا حبيب الله يا رسول الله يا رسول الله يا حبيب الله يا
Assalamu alaikum. Welcome to Parenting Hour. You're tuned into Unity FM 93.5 here in Birmingham and the West Midlands, and 105.1 down further south in the country. And we have a wide reach of listeners tuning in to us today. Welcome to everybody. I hope you're having a good day, a good week. Indeed, the weather has changed a bit. Our little lovely sunshine has gone, but we hope that that's not the end of summer and that it will come back again to us. This evening we have a show that I think all of our listeners will be interested in, if not for yourself, probably for some members of your family or for your friends or relatives, where we're going to be talking about the maternity services and the changes that is happening now due to COVID-19. And as you know, on the show, we only bring in experts indeed on Parenting Hour to join me when we do our shows every week. And this week we have the best of experts here with us this evening. We have Rachel Carter and Alison Talbot from two maternity hospitals, the heads of maternity in both in Birmingham Women's Hospital and in Heartlands Hospital. Isn't that right? Welcome, Rachel and Alison.
That's right. Hello, this is Rachel Carter.
Hi, it's Alison Talbot here. I cover Heartlands and Good Hope and Solihull Hospital and University Hospitals Birmingham Trust.
Wow, that's a lot. Thank you indeed. And we were going to have Helen as well, Helen Trust with us, but unfortunately something came up, and as midwives and head of departments, we understand that it's a busy time and life can take over and issues come up. So unfortunately we couldn't have her on this evening, but I'm sure another time we will hope to have her on as well. So maybe if we do a little bit of introductions into you both and who you are, what exactly you cover, and a little bit about that kind of work first before we go into COVID-19 and all the changes that's happening.
Yeah, of course. This is Rachel Carter. So my role is Head of Midwifery and Deputy Chief Nurse for Birmingham Women's Hospital, which is part of Birmingham Women and Children's Hospital, NHS Foundation Trust. So we care for around 8,250 women who give birth with us, but there's quite a lot more of those ladies who we care for in the community and then who give birth within our local maternity system, which means that we join up with our partners at University Hospitals Birmingham and Heartlands, which is Alison. So we work very closely to make sure that our ladies get very much the same offer and the same service. Within our hospital, we care for ladies who come for gynecology operations, gynecology outpatient care. We have a fertility service. We also have neonatal care. But really, I think today I'm here to talk to you about our maternity service, where we provide antenatal care, postnatal care and birth, which happens in our hospital, but also at home and within our birthing centre. I don't know, Alison, do you want to?
Yeah, hi. As I said before, my name is Alison Talbot. I'm Divisional Director of Midwifery at University Hospital Birmingham. So I cover Heartlands Hospital, Good Hope Hospital and Solihull Hospital. We currently deliver, we have labour wards on all 3 sites, but our Solihull unit is a home-from-home unit where we just deliver low-risk women there. We also, as Rachel said, very similar, we look after ladies who need gynecology appointments. We also have neonatal service, so newborn babies, and across the trust we have paediatrics. So, and I would say as well that we, exactly the same, cover antenatal, postnatal care and labour. We offer care on a consultant-led labour ward, a midwife-led care unit, and also at home. And as Rachel said, we're here today to talk to you about maternity services, how we've responded to the COVID pandemic as 2 different hospitals, but also across our local maternity system.
Thank you so much. That is a wonderful introduction, and I'm sure our listeners will want to engage with us this evening, with you this evening. If you want to ring in, please do so. We'd love to hear from you. Our number is, as usual, 0121 772 8892, and you can pose a question to either one of our guests here this evening, or have a discussion about what worries you, or if you've had experience of the maternity hospitals and you've delivered a baby recently. We'd love to hear that experiences. We'd love to hear the good practices that are going on, and we'd love to hear if there were some issues you had as well, and how we can overcome those issues. Indeed, we're all trying to help our parents here to have safe and happy deliveries, and if anybody has watched the TV program recently, you must be very happy with that, Rachel, because that was just a wonderful series on TV. I really enjoyed watching all the births taking place and the journeys of people.
Yes, we were very proud for both hospitals to be included. I think what the aim of that programme was to show how we are working across the city as 2 hospitals, but together. So making sure that all of our women get the same care experience, regardless of the surroundings that they're in. You know, as midwives, we take great care of all women, and it's our privilege to be able to be part of that journey. And I think what you were able to see on that show were some of our more specialist areas as well. So you saw some of our fetal medicine areas, and also neonatal unit, and how the transition can happen where we have babies that we diagnose when they're still inside mum's tummies, to be born here and then go across to the children's hospital. So it was a great privilege to be able to showcase some of those services that both sites can offer.
It was, and actually just shows the depth and the breadth of work that you do in both hospitals, in all the hospitals actually in Birmingham. And Birmingham should be very proud of its maternity service, because that was a real eye-opener, I think, to a lot of people, seeing that and seeing the intensity of some of the work, and some of, as you mentioned there, some of the difficulties picked up earlier on, and even dealt with in the womb while the mum was still pregnant, and given treatment. It was wonderful to see. And then we saw also the home birth team, which we were used to here on this program. We've interviewed a few times the home birth team, and we've had parents who experienced home births, and we've had a whole show around dads one time experiencing home births as well, and it's always well received. And actually some of our listeners have experienced that may ring in this evening as well. I know they have rang in the past when we've put on other shows. So it would be lovely, listeners, if you are tuned in and able to get to a phone. I know it's a little bit different when we're in lockdown. We're not listening to this on our usual journey home from work, and have time to be able to pick up the phone and ring. A lot of us are still working from home, and maybe we're distracted with children and doing other things at home. But if you are tuning in, please do pick up the phone and ring us, indeed, with, as I mentioned, good practices as well as other issues. We have the experts here this evening to help you and to answer your queries and to guide you. So if we were to talk about COVID-19 and the changes that has happened over the last few months now, since March in particular, since lockdown, what has changed? I wonder
So this is Rachel, and then I'll hand over to Alison. So I think what we have to recognise is we had a little bit of warning that COVID was coming, but I don't think anybody anywhere would ever say that anyone was able to anticipate the degree to which it affected all of us, either in our personal lives or in our work life, but also for those mums and babies who couldn't defer their plan of care, like a booked operation. So I think what was one of our main objectives was to make sure that we continue to be there by women's side at all times, to make sure that regardless of whether the environment looked a little bit strange and different, and whether we were wearing masks and plastic aprons and things that we wouldn't normally encounter women with, it meant that they could still feel our smiles and feel our care and still feel that we wanted to be there for them. So in terms of what we've changed, we did an awful lot in a very, very short space of time. I think Alison would agree that we've probably done 3 years worth of work in 3 months. That meant behind the scenes, we were writing lots of guidelines and policies as the national guidance came out to help us to make sure we kept our women safe, our babies safe, and our own staff and families safe. So a lot of writing has happened, a lot of scouring of national guidance and best practice. Certainly across the West Midlands, we've tried very much to work in synergy. So all the units have clubbed together as heads of midwifery. We've got a very strong link within our West Midlands heads of midwifery group, which meant we were able to access each other to find out what was the best way to approach a different situation. But in terms of services, we still provided all of our services, but we did it in a different way. So rather than being able to see women for every appointment face to face, we were still able to maintain the number of appointments, but we had to follow that changing guidance, which said some of them were more virtual. So we were then able to risk assess and screen all of our women to decide who really needed to have that face-to-face contact, either in the hospital or outside of the hospital. We had to respond to GP practices closing with no notice, which is an unprecedented situation that I know that everybody will understand the reasons why, because ultimately it was to keep everybody safe and at home. But we were then able to make sure that we put things in place where midwives could still reach women and still see them outside the hospital as well as in the hospital. And in terms of our inpatient care, it meant we had a very difficult decision to make about who actually needed to be in the building and to keep all those women and the staff safe. Unfortunately, some people weren't able to come into the building, and we're still working through that as we go through the national guidance, waiting for those leaders to advise us of the changes. Alison, do you want to share?
I think I'd echo that. It has been incredibly challenging, but I think as two organisations, we've done fantastically well, as Rachel said, to maintain a safe, high-quality service across the whole of Birmingham, and I will speak on behalf of Helen as well. At UHB, we did have to make a change to our home birth service, and that was based on the challenges we had with staffing levels. And we wanted to, obviously, we had to do that in response to continuing a safe quality service everywhere else. But while we did take down our home birth service for a number of weeks, we offered the alternative, which was our midwife-led care unit, where we could offer home from home within the actual hospital settings. And I think certainly from the women who have used our service throughout that time, that wasn't particularly a massive problem and didn't cause them too much anxiety. So I think in hindsight, we could say that we handled that very well. I think another thing that's been incredibly challenging is the guidance from Public Health England and NHS England, which was changing literally every few days, particularly at the start, to keep on top of that, but also to keep the communication out to our women. And someone might tell us differently, but we developed quite a suite of kind of information to get out to our women to inform them of the changes that we'd made. We updated our website, etc. And I think, that is continuing to be work in progress because we are still changing the services. And I think the big change, as Rachel said, was the virtual platform for us to be able to have telephone conferences and video conferences with our women and their families. And I think that is something that we will definitely embrace and take into the future, because I think in some circumstances that is a really powerful medium to use moving forward.
Yes, I totally agree there. With the virtual was something that we did from Approachable Parenting, something new again. And we're just a very small organisation, not like huge NHS and the maternity services and the amount of protocols that you need to address. But it was a really good way of meeting parents and reaching out to them and having that contact. Because especially if we go back to March time, people were very worried, very anxious what was happening. And as you said, it was practically on a daily basis, not even on a weekly basis, that things were changing and information was changing back then. And very tense for everybody, not just parents, but then professionals as well. And really hard for everybody to understand and incorporate. And not everybody was getting that proper or correct information. There was a lot of misinformation going around as well at that time, which unfortunately then made anxieties go higher and higher. So do you think if we were to do something like this again, and hopefully we wouldn't go into phase 2 again, was there anything that you have learned or that you would do differently from that whole experience of where you started going into lockdown, etc.? I'm sure we've all learned a lot. But is there anything differently that you would think you would do?
I think for me, so if we went back and we knew that this was going to happen again, so if we had it in a planned way, then we would have everything lined up, ready to go on day one. Mm-hmm. So regrettably, there are times where we had to prioritise getting the services right and the clinical guidelines right before we were then able to communicate out to women. But as soon as we had something that we could then be quite solid in terms of the information we were able to give, that's where we were also able to put our parent education on a virtual platform, and our home birth teams, we had to slow down a little bit of our social media because we needed to make sure that we got the right message out, and that was our priority, and that was around safety. So I think we've now got a whole suite, as Alison said, of documentation, of leaflets. We got them done to a professional standard, because what we didn't want was women to see information that came out as a Word document, because it doesn't necessarily carry the weight and the confidence behind it. So we did go to great lengths to make sure that we got the robust information in multiple languages. We were able to get 5 of our top languages after we spoke to women to be able to reach them, and also to find out how they access information. So I think in terms of communication, we would all want that to be one of our number one priorities. But this way round, unfortunately, the communication coming to us was so staggered that we just had to make sure that we had the right information in the right way. And I think if it were to happen again, some of that information may even have changed, because we know a lot more now than we did at the beginning. So at least we've now got the templates there that we can quickly adapt. And likewise, reaching out to women through our midwives, it was very important that they knew what care they could provide and where. And as you quite rightly say, Kathleen, it was changing at a rate of knots in an unprecedented way. So I think we just have to sort of look back, reflect and learn, and have that information ready should we have to reach for it again.
Mm-hmm. Because I was finding that some information or some things that were even being printed in the paper were maybe happening in London, but not in Birmingham. And then people would pick up, and mums would pick it up in Birmingham, or this is happening or that's happening, and it wasn't quite true. And that's where the filtering system for us took place. And we were lucky also that we were able to have access to a midwife who was able to give us the correct information. So I think, as you rightly say, if hindsight is wonderful, and if we could prepare, we would all be better the next time, I think, in preparing and thinking what to do. And I love those sheets that you did put up in different languages. Actually, a lot of lovely information came up, which we put out, Bump put out, a lot of organizations put out for parents to be able to reach that in their different languages. We also found, though, that it was useful for having information in spoken, like verbal information, short little clips. Did you get that back in your feedback from any parents that would be a useful way of having information to cascade information out to people that don't speak English and maybe even don't even read their own mother tongue? Sometimes some people don't have that ability or not literate in their own mother tongue.
I think that was a national ask, actually. So we were very fortunate that our Chief Midwifery Officer, Kathleen Dunkley-Bent, and her team pulled some things together. So across our social media platforms and through other groups, we've been able to send those messages out. So on our we used an electronic system called Badgernet for our maternity records. So all women, we were able to push out multiple versions of information so they can press on their app and be able to then see this information in their own language. But there are also little videos that talk to them about social distancing, about careful hand washing, about what services are still available. And I think one of the big messages that Alison and I are very, very passionate about was trying to reach women to encourage them that even if they're very scared of coming to our services, if their baby's movements change in any way, shape or form, regardless of their fear, we still needed them to come to us, because what we were worried about mostly was that some, as you say, the misinformation and the rumours and the inaccurate information may make women feel that they don't want to come to a hospital because it's not safe, where actually the safest thing for them to do was to still carry on and take note of their baby's movements, as it is now and as it always will be, because we really are here as services to receive those women and make sure that we get intervention very quickly if their baby's movements change.
A very important message to get out there. And I think, listeners, if you're tuned in this evening and if you go away with one take-home message, please take home this message, that services are there. If there's any reduction in fetal movement, if you're worried about anything, please contact your maternity services immediately, and don't be holding back and thinking about something. The services are there. They're able to answer. They're there 24 hours for you. So listeners, please do take that on board, and don't be asking people, because we have come across this in our WhatsApp groups of people asking information also on the group that they should be asking triage, or they should be ringing directly to the hospital. So we've had to tell them straight away to do that. So I really want to reinforce that message again this evening, before we go into break time, is because we'll be heading into break shortly, that people pass on that message. Indeed. I think we've just got a minute or so left, and maybe we'll be able to talk about community appointments. Are they still taking place at the moment? And if so, where are they taking place?
Hi, this is Alison. As Rachel already alluded to earlier, a number of our GP surgeries did close very early on. So we worked very, very quickly with our commissioners to be able to call what we've called purple.
Following is a repeat show that was previously broadcast on Unity FM.
Assalamu alaikum. Welcome back to Parenting Hour. You're tuned in to Unity FM 93.5 and 105.1. My name is Kathleen, and we are continuing a very interesting show with Rachel and Alison, both here from covering maternity hospitals all over Birmingham, really, what they're doing in all the areas, and giving us a live update on the challenges, on the changes, on what they have put into place during this pandemic, and what is going to be for you as parents differently if you're pregnant and if you're going to deliver. So we were just kind of talking around that before we went into break, about the antenatal appointments and what's happening now and what changes are happening there. So sorry, Alison, I had to cut you off there just going into commercial break. You were saying, if you would like to continue.
Yes, so thank you, Kathleen. I was just saying, obviously, as Rachel alluded to earlier, that there were a number of GP surgeries that had to close very quickly. So we had to work very, very closely with our local commissioners to find places to host our community clinics. And what they did was develop what they call purple sites, but essentially a number of GPs going into one site. So I will apologise in advance, because that happened very quickly. If some women using our service didn't get that communication as quickly as we'd like it to, but obviously, as I say, things did change overnight. But we also worked very quickly. We developed, particularly at Heartland's site, we utilised one of our closed outdoor buildings as an antenatal and a postnatal clinic, and we also have considered other avenues since, because obviously that made it very local to some of our local, our particularly high-risk communities. So essentially that's where it is now, certainly across the UHB footprint, and we are waiting for regional news around whether GP surgeries will be reopening or if we can move to different sites moving forward. But we will, every step that we take, we will communicate that out via all the different methods of communication we've got now, and also via our community midwives. But just to provide some assurance to everywhere, or some reassurance, that no antenatal clinics are being cancelled. If they're needed, we will absolutely see you. So all the changes that we've made have not impacted on being able to deliver a safe service.
That's really good to know, indeed, that where safety first seems to be the motto as we're going forward. So we've had some changes in the community. What about the hospital? Have we had much changes happening in the different hospitals?
Yeah, so I think that the biggest thing you'll see now if you walk into our hospital is you will be met at the door by somebody who is asking you to, if you haven't already come with a face covering, then we are providing one. But ideally what we'd like is all of our women and families who are engaging with our care in the hospital to attend with a face covering. We then signpost you through to one of our hand wash stations, and somebody will advise you how to wash your hands if you're not aware. And I know that might sound like a very simple thing, but it's really important that it's not a splash of water, it's actually a proper hand wash, because that is our biggest defence against COVID. So you'll then see some signage which tells you how to travel and how to move around the building. And we use, certainly the women's, we're using a one-way system. So it means that you have the maximum amount of distance between you and another person who you may pass. And then we ask you to go directly to your appointment. Because of the size of our building and because of the national guidance with social distancing measures, which are maximum, at the moment, the optimal way is to have 2 meters distance between people or 1 meter with any dividing space. We are still asking that women attend most of these appointments alone and accompanied, which is really hard for us because we try as a service very much to encourage full family support and care, but at the moment that is the way that the national guidance steers us, so that is what we're still following, and as soon as that should change we'll be able to communicate differently. And then after your appointment you'll follow the route back out to the main entrance. Certainly when you have your baby, when you come into the service, we then welcome the birthing partner to be with the woman in labour, because obviously that's something that's an absolute essential, and all the staff that you encounter will be wearing face masks, and then in other areas you'll see them with gloves, maybe a visor or goggles and glasses, and aprons. And then upon the ward as well, you'll be supported by the midwives, the support workers. We've got nursing staff, and we've also got the doctors that will visit you. So I think essentially you'll still get the information that you need, but in a way that it's slightly different. What has been really encouraging is we've been able to receive quite a lot of compliments from ladies who understand that things are a little bit different, but what they've welcomed is they've been able to actually talk more openly to the other ladies that they're maybe in a bay with. So although they've got their curtains, they're opening a little bit more so, and they're actually communicating within the bays where there aren't as many visitors or there aren't any visitors coming through. So they're quite enjoying the support they're giving each other, and it's really lovely because it's almost like back 20 years where we've actually got ladies who are wanting to talk to each other about their babies and forming and forging those relationships with each other, and probably life-lasting friendships. So we are seeing some real bonuses of the way we're working, but it is slightly different to what you may have experienced previously.
Actually, you had me smiling there, because before you even said 20 years, it reminded me of my midwifery days, because that's what it was like when I was a midwife. We actually only had visiting hours, and we had hours. I trained in Ireland in National Maternity Hospital, and we had hours in the daytime that was totally rest, that there was no visitors allowed, that we'd take the babies to the nursery, and mums were encouraged to sleep and rest for those 2 hours of the day every day, which doesn't happen now, I think. But I think it's something that women do need. They need to give their bodies time to recover and have that rest indeed. But we have a guest over the phone, and I need to go to this caller who's been waiting a few minutes now. So caller, Assalamu alaikum. It's a bit hard for me to hear you. Would you like to share your name?
Okay, can you hear me now?
That's better. That's much better. Thank you.
Right, my name's Amanda. I'm from Maternity Engagement Action.
Well, hello, Amanda. Welcome to Unity FM Parenting Hour.
Great, yeah. Well, what I wanted to say was, obviously the work has been, incredibly difficult during this unprecedented time. So, we do have to thank our maternity services staff and the heads of midwifery and all the teams that have been working to support women during this time. I have been gathering some birth experiences from local women who have been birthing or who have birthed in the past couple of years and during C-19. So I'm getting a mixture of stories and experiences. Some make you want to weep. Some have been incredibly empowering. And some have been, on the verge of quite dangerous. But what I wanted to know from both Rachel and Alison is, since lockdown, with all the changes that happened in maternity services, what sort of indirect COVID-19 consequences has there been to maternal and fetal health? And how are these being recorded for lessons learned, going forward? I mean, I heard you talk a little bit about if this happens again, what would we do differently? But I just want to know if they're able to share, have there been any indirect consequences to the health and well-being of mothers and newborn babies?
That's a really interesting question. Thank you for your positive comments as well. Obviously the staff have worked incredibly hard, and it's really heartening when we hear that we get things right, and disheartening when we hear that we don't, because that's never intended. I think one of the big things for us here has been the rumour. So what has kept me awake at night perhaps has been more so the impact of the rumour mill. So where a story of somebody's birth that maybe may be escalated and not entirely in line with what actually happened, then is shared, and it kind of grows a little bit, and it grows again and it grows again. And that then is quite dangerous, because a poor experience for one woman then becomes a nightmare for another. And my anxiety is for each story that may be told in a different way, how many women then don't access and try to seek care where they should. So what is the unintended consequence then of somebody sharing an experience that then impacts how another woman may then not access care? For example, we do talk a lot about reduced fetal movements, and I think what I would hate to hear or see ever is that a woman didn't come to the hospital because she's had a fear that's been imposed upon her, and the consequence of that could be something that is going to affect her for her life. So I think the biggest thing is making sure that we hear our women. So we do have our Maternity Voices partnership. So we look and we seek for those women to access us through that route. And I think another consequence, going back to talking about how our visiting is on the wards now, Alison and I have both spoken at length about the impact of women not having the loved ones closest to them. But we've actually seen something we weren't expecting. So an unintended consequence of that is our breastfeeding rates have increased. So we've seen women who are openly breastfeeding and talking to other women and enjoying breastfeeding by choice. And it means that we're having more women going home breastfeeding than we do when we have wards with visitors at times. So we think we've got it wrong in the past, or we thought we were doing the right thing by opening up our visiting. Where actually what we need to do is ask women now, with their recent experiences, what do you want and how do you want us to get what our new normal will be, so that we fully engage with them and listen and do what is right for them, as opposed to what we believe is right for everybody. Alison?
Yeah, I'd just like to add, Amanda, we're trying to reach out to as many avenues as we can to get feedback from our women around their experience, both positive and negative. And I said we have noticed a lot of positive feedback, but if you said you've had some negative and some that wants to make you weak, it'd be really useful, if not to share it now, but if you could contact us via Kathleen, because as much evidence as we can will obviously help us, if we have to step everything up or change things for phase 2, but also in terms of moving forward for the entire service. Our experience feedback is one of the most important avenues that we can get for improving the service moving forward. Would that be okay?
Yes, I mean, the work that I do is about ensuring that those voices come along to Maternity Voices partnerships. I mean, in Sandwell and West Birmingham, we don't have one as yet, so I'm hoping that very soon, I'm doing a lot of prayer for it, that we're going to have one, that we can come along and share those experiences, because it's really very important that if we're going to have transformation in maternity services, that the voices of the women are part of that. And when I say the voices of the women, I'm talking about, specific communities. So I'm talking about Black women of African descent and South Asian women, and then of course, obviously, women from Eastern Europe who are not really getting the service that they deserve and need. I mean, I've got some stories that as I said, I would definitely want to share those with you moving forward. But it's those stories, it's from those communities that we really need to try and have better engagement and better communication, better relationship building, I suppose. So thank you for that. Thank you. That's really, really interesting. I do have... Oh, sorry.
So I'm just going to say what we can do is link up. We're doing a piece of work at the moment, linking our MVP up very much with all our women, but also including City and Sandwell into that group. So that piece of work has already started. So if we could engage you in that and expand kind of our route of getting feedback, that would be fantastic.
Yeah, we can get that information of how we can reach you perhaps through Kathleen, because as you know, the city is quite far and wide, and although we're coming from 2 of the units, there is a 3rd unit which is City and Sandwell, which sounds like that's the area that we also have a need to reach to. So as a group of heads of midwifery, we want to listen and learn, because it may be an experience that somebody in a different service can influence and impact somebody in our services as well. So it is really important.
Yeah. I have one more quick question. Is that okay, Sister Kathleen, or do I have to leave for room for other people
just
to
very
come
quickly, because we have a few callers waiting on the line. So if you don't, yes, just one quick one. That's okay.
It won't be too long. It's just that, you know, we have the statistics of 5 times more, which affects black women of African descent. Bradford has a specialist cultural midwife, and I'm just wondering, will Birmingham dedicate a similar investment so that we can combat that statistic and reduce that 5 times more for black women?
That's quite a topical question, so we can't answer you directly, but it is something that we are working with our local maternity system. So you talked about maternity transformation, and through that programme of work, it gives us some fantastic opportunity. So far through that work, we've been able to open up for smoking cessation interventions. We've looked at fetal surveillance, and certainly with the information that we've now got access to through COVID and before, Jackie Dunkley-Bent, our Chief Midwifery Officer, is very much engaged in making sure we get the information. So it's something that Alison and I were talking about just this morning. So very topical question, but it is something that we're definitely starting to look at with a view to us perhaps implementing quite soon. So watch this space, I would say.
Okay, brilliant. Thank you. Thank you ever so much. Thank you, Sister Kathleen.
Thank you, Amanda, for ringing in. Thank you. They were very interesting questions indeed, and a lot that we're learning from this process and moving forward. And again, I'm smiling at the breastfeeding rates going up and the different changes to visiting, how that has made a difference, which gets us to think about, as you said, what else do we need to think about changing in the whole maternity system to make it easier for our parents. Wow, that's really good that you're actually looking at these evidence, especially for the BAME community as well, and how we can make things better for them. I'm not sure if the next caller is ready or not. I'm just waiting for the studio manager to let me know if the next caller is ready before we go ahead and ask you some more questions. Haven't had a message in yet. So let us continue discussing around differences in the hospital first, because we were talking about appointments and difference in the hospital, and we'll come back to some of the other issues. So if you're giving birth now, and I know there has been a lot of questions around this, about giving birth and bringing somebody in with you, and where can somebody come with you, when can they come with you? A lot of people are feeling they're delivering alone, or maybe delivering alone, and if English is not their first language, how can they communicate? So I will continue going with my question about hospitals. What changes has happened over COVID, and what's in place now as we're kind of coming out of some restrictions?
So you've asked about birth partners, which I think is a lot of people are asking about. And we absolutely still encourage our women to have a named birth partner with them. At the moment, following the national guidance, because of the size, as I said, of our rooms and our waiting areas, and the traffic or the travelling of women through the hospital, to make sure we keep them as safe as we possibly can, we are only having birth partners in the labour room. So when they come in labour and we assess them, that's when they have their birth partner. And then when they've had their baby, no matter how that may be, hopefully by normal birth in our birthing centre, if not in the labour ward or in the theatre, then it's at the point where they're ready to go to the ward that they stay and the birth partner then goes home as the woman goes to the ward. If the woman needs things bringing to her as a new mum, then we welcome that to be dropped off at our main entrance, and we have some helpers who then take that to the ward, and then we get them home. But we are seeing that we are managing to get it right for women, and it's trying to be compassionate at the same time. Where we've got women who've got specific needs that I won't go into in detail, but we are making personalised care plans as well, so making sure that we do try to listen to those needs and make a specific plan for women. And of course we have our home births, where it's the midwife who is the visitor, who's the guest in the home, So we make sure that at that point the midwife is equipped in terms of the protective equipment, and we prepare women beforehand what to expect when the midwife comes to her home.
And have you seen a rise in home births? Just before I go to a caller, there is the caller's back again. Have you seen a rise in home births over this pandemic?
No, we actually haven't. So we've got a dedicated home birth team, and it's because of the way that team is set up, and also all credit to that team. They are so passionate about the service they provide that we sustained that service, and that's a pure credit down to those women and those midwives. And so we've tried to increase the number of home births. And we certainly saw an increase for a small time in the number of women booking home birth. But in terms of the women that were already booked for home birth, we didn't really see a difference. But obviously, we're very welcoming of that. So any woman that does want a home birth, a little plug really, is get in touch with either service, because it's definitely a service that we want to see an increase in for those women where home is the absolute safest choice for them.
Great, wonderful. We'll go straight to our caller now. Caller, are you there? Caller, are you there?
Hi there, hi.
Hello, hi there.
Hi.
Would you like to give us your name?
Yeah, it's Erin calling.
Okay, hello Erin.
I've got a couple of questions for your guest, Kathleen.
Okay.
Hi, Alison and Rachel. Can you hear me?
Yeah, hi.
Hi, thank you so much for your time. And I'm sure, there's some really, really great information that it's really, really useful for our parents there. So I'm from Approachable Parenting, and we've set up, as Kathleen mentioned before, WhatsApp groups for parents, and one of them is for expectant mothers. And we've just received some, and I know you've just been speaking about that, about visitors and having birthing partners, and there's a lot of concern still around having your partner around, and I think you just one of you were just speaking about that. So what was the current? If you can just repeat that, just for our for your listeners, about having your partner there. Are they allowed to have a partner throughout the whole of labour? And I also have another question, if you're able to answer that as well, which is also from one of our parents on the WhatsApp group. So this mom, she just wants to know that she normally used to enjoy all the food, but during this pregnancy she had really bad vomiting at the start, and also has gestational diabetes and has been put off food, but now she's concerned about her weight. She's not sure if she's even gaining any weight. So what would you say to her? Thank you so much.
We'll start. Hi, this is Alison from UHB. Just to echo what Rachel said about visiting, we have followed national guidance, which is that a birth partner can join for the whole of labour. Unfortunately, at the moment, that doesn't include the induction process, but obviously as soon as labour starts, then a birth partner will be asked to join. The only time that we would encourage that not to happen is if a birth partner was symptomatic, as I had the symptoms of COVID. However, we haven't seen hardly any of that. So absolutely, a birth partner is very welcome and very encouraged, and we recognise the importance of that throughout labour. But when women have delivered and go up to the ward, then the birth partner will be asked to leave. And the reason for this is, as I've said, we're following national guidance across both organisations, but also this is essentially to ensure that we can maintain social distancing. So, the building, the estates we've had can't be changed, obviously very, very quickly, but we have to maintain as far as we can that safe social distancing. So it is constantly under review, and it is a hot topic both regionally and nationally at the moment. And we will be awaiting national evidence to come out to suggest that we can change that. In terms of your second question, if anyone is worried about themselves, I would absolutely encourage them to ring the hospital, ring the triage on the delivery suite, or we do have hotline numbers as well, which we've put up for COVID. But if anyone is worried, what we just don't want to see is anyone sat at home worrying without having their questions answered. There are midwives in both organisations. They're 24 hours a day that can answer the questions, and if necessary, we'll encourage women to come into the hospital to get checked out and checked over.
Great.
Can you pass that message on?
Yes, we will do. Thank you so much for that. I'm sure they were really pleased to know that. I think it's just that, anxiety and kind of just picking that phone up and wanting to ring. But thank you so much. We will pass that information back. Absolutely, your lines are always open. So if anybody has any concerns that they should and must call. Thank you so much for that.
The other thing is obviously to contact their community midwife directly as well. So
Yeah.
there's a number of avenues that they could go to.
Mm-hmm.
And hopefully, they would feel comfortable with at least one of those. But that's really, really important. I can't stress that message.
Sure, great. Thank you. Thanks for that.
Thank you for your call indeed. You mentioned there about labour starting, that somebody would be with you. When would you kind of determine labour starting? Is there a certain dilatation that you go by, or how do you monitor this? Because people get confused over, because when they see pains from the beginning, and we know that maybe birth mightn't happen for a couple of days, but people feel they're in labour from the very first pain. So how do you determine labour starts to our listeners that are listening in and think that they may be in labour? And
so I think that it's very clear that labour isn't a complete science. It's something that is very individual to each woman. So if you go by the guidance, then there are certain measures that we take. So some of those are on vaginal examination. Sometimes it's talking to the woman, observing how she's coping, her demeanour, how she feels. We also take into consideration any previous births that she may have had or previous experiences, and also her family, and what labour's been like with her family members as well. So a lot of it is around the pre-admission sort of education and that assessment that's a whole assessment of the woman, and also taking into account of what she wants. In terms of when she has somebody with her, when we say for labour, that means when she's in a room on her own on the labour ward. So at that point where she needs to have a midwife with her for direct one-to-one care, and that's where we can then invite in their birth partner. It's not ideal, it's not what we would want, and what we are trying to do is make sure that our antenatal education enables women to stay at home for the period of time where they can be supported, so that the time where they're away from their loved ones or their birth partner, if it's somebody outside of their immediate family, is for as short a time as possible. So I think if anybody is worried about what that might look or feel like, I would encourage them very strongly to talk to their community midwife, so that they've got that individual plan ready, so they understand exactly what to expect, how to cope, and to understand why we're doing what we're doing at the moment. So we'll see as things change if we can get ourselves back to how we were before, which is where we encourage more support within the hospital.
Well, I love that positive attitude. As we're coming to the end of the show, you wouldn't believe that the whole hour is gone already. We've, in our last minute or so left, is there any messages that you would like to get out to your listeners? Last 30 seconds, actually, I've been told.
I think from both of us, we'd absolutely like to say, please don't be scared to come into hospital. We're doing absolutely everything we can to continue our safe, high-quality service. So please don't sit at home worrying. Please contact us. If you're worried about reduced fetal movements or anything at all, please contact us and come in, and we'll check you out and try and reassure you.
Thank you so much. Thank you for coming on the show.